You wake up one morning and something feels, your fingers don't bend as easily, your knees ache before you even get out of bed. You chalk it up to getting older. But what if these are more than just aging? What if they're the very first warning signs of arthritis? Today, we're diving deep into the earliest, most overlooked, and most dangerous to ignore symptoms of arthritis, ones that doctors say you should never brush aside, because the sooner you spot them, the better your chances at stopping pain before it takes over your life. Imagine this. You wake up and feel like the Tin Man. Your knees don't bend easily, your fingers resist curling, and your whole body feels like it needs oil. Most people call it just getting old. But here's the truth. Morning stiffness that lasts longer than 30 minutes is often the first clinical sign of arthritis. According to the Arthritis Foundation, the key difference between age-related stiffness and arthritis is duration and consistency. If it happens daily and doesn't ease quickly, it could point to inflammation inside the joint capsule, a hallmark of early arthritis. This stiffness may start in just one joint, but gradually spread. Be worse after long periods of rest, like sleeping or sitting. Loosen up after light movement, but return by the next morning. Many people describe it as feeling rusty in the morning, needing time to warm up. That's not normal aging. That's early arthritis trying to introduce itself. The type of arthritis can even be guessed based on stiffness. Osteoarthritis tends to cause brief stiffness, under 30 min, and worsens with activity. Rheumatoid arthritis often starts with prolonged stiffness, especially in hands and feet, that eases only slightly with movement. If your mornings are getting slower, listen closely. Your body is raising a red flag. Have you ever felt joint pain out of nowhere? You didn't fall. You didn't overwork your hands. But suddenly your knee aches, or your fingers throb. That kind of pain without clear cause is one of the most deceptive early symptoms of arthritis. Here's why it's dangerous. We often blame it on weather, overuse, or even our mattress. But in reality, arthritis pain can begin months and even years before visible damage shows up on an X-ray. Researchers at the Mayo Clinic discovered that low-grade joint pain in older adults often goes undiagnosed until irreversible cartilage loss has already begun. Key traits of early arthritis pain: feels deep or dull, not sharp. Appears in commonly used joints, fingers, knees, hips, lower back. Worsens with use, but sometimes hurts, even at rest. May improve with light activity, unlike injury pain, which worsens with movement. One of the most telling signs is symmetry. For example, pain in both hands or both knees at once can indicate systemic inflammation, especially in autoimmune forms like rheumatoid arthritis. This kind of pain tends to creep up gradually. You might start avoiding stairs, skipping chores, or typing less, not realizing your joint health is declining. If your pain isn't tied to a specific injury, it's time to ask questions. When most people think of arthritis, they imagine swollen knuckles and inflamed knees. But the truth is, swelling doesn't always come first. Still, when it does appear, even slightly, it's one of the clearest signs that inflammation is active. Early-stage joint swelling can look like rings feeling tight on your fingers in the morning, a puffiness around your joints, especially the knuckles or knees, a full feeling in the joint, as if it's bloated, the skin feeling warmer over the joint, even mildly red. This happens because the synovial membrane, which lines the joints, becomes inflamed and produces excess fluid. This response is the body trying to protect itself, but it ends up damaging cartilage over time. In rheumatoid arthritis, this swelling can come and go in waves, even jumping between joints. In osteoarthritis, it tends to develop slowly and stay. And yes, the weather pain is real. A drop in barometric pressure can cause joints to swell slightly, which makes inflammation worse. A 2019 study from Harvard Health confirmed that humidity and air pressure changes can increase arthritis-related pain and swelling. If you're suddenly noticing puffiness, warmth, or tightness in joints you used to ignore, don't brush it off. Swelling is your body's siren. Listen, let's look at the subtler signs, the ones most people never connect to arthritis until it's too late. 1. Fatigue. If you feel deeply tired even after a full night's sleep, and especially if it's paired with joint discomfort, it could be more than just aging. Chronic fatigue is a key early symptom of inflammatory arthritis, like RA or lupus-related arthritis. Inflammation taxes your immune system 24/7. Your body is fighting a war you can't see, and that drains energy fast. 2. Crepitus, joint noises. Ever hear clicking, grinding, or crackling when you bend your knee or rotate your shoulder? That's not just old bones. It could be cartilage wearing down, exposing bone-on-bone movement. You may not feel pain yet, but the sound is telling you that cushioning is being lost, and the earlier you address it, the better. 3. Loss of flexibility or range. Have you noticed it's harder to kneel, squat, or even twist open a jar? That's more than stiffness. It's mechanical breakdown. When joints become inflamed or damaged, you lose flexibility. You adapt, avoiding deep bends or long walks, but those adjustments cost you strength over time. According to the IAMS, National Institute of Arthritis and Musculoskeletal and Skin Diseases, loss of joint function can begin within months of inflammation onset, but many people delay treatment until permanent limitations set in. These warning signs are like cracks in a windshield, small now, but dangerous if left alone. So now you know. Arthritis doesn't start with screaming pain or twisted fingers. It starts with whispers, stiff mornings, unexplained aches, mild swelling, deep fatigue, and tiny losses of movement. The sooner you recognize those whispers, the sooner you can respond and protect your joints for years to come. If anything in this video sounded familiar, don't wait. Take action now. Track your symptoms, talk to your doctor, and explore natural ways to reduce inflammation, from movement to anti-inflammatory foods. And of course, subscribe to Arthritis Relief Daily, where we break down everything you need to know about joint health after 50. We'll keep you informed, empowered, and moving with less pain and more freedom. Hit that bell icon so you never miss a tip, and drop a comment below if you've experienced any of these early signs. Your story could help someone else catch it in time. Let's fight arthritis smarter, together.